All right, to discuss this further, we're now joined by SABC specialist researcher Zandile Myeza. Zandi, a very good afternoon to you. So, I mean, when we looked at this conversation and this topic about health, it's so broad. You, of course, have been attending a number of meetings, visiting a number of scientific centers too, just to help us unpack all of this. What are some of the discussions that have been held, particularly when you look at some of the health working groups? I know that a fourth health working group was held recently. Just speak us through just some of the conversations that have been held.
So pandemic preparedness, prevention and response was such an integral part of the fourth G20 Health Working Group meeting. Essentially, everybody came together to say we experienced sobering lessons from the COVID-19 pandemic. It essentially exposed the structural shortcomings of health systems around the world. How do we stay pandemic ready is what's at the center of pandemic preparedness and response. The other issue that was quite important within that conversation was around locally manufactured vaccines. So what we saw play out during the COVID-19 pandemic is that the countries with stronger economies were able to access vaccines quite swiftly. And countries who couldn't afford were essentially at the bottom of the barrel, while infection rates were rapidly increasing and mortality rates were skyrocketing.
Absolutely, I remember that, especially for South Africa.
So essentially what the vaccine conversation also spoke about is trying to make sure that South Africa and the African region and the global nation prepare for a pandemic within vaccines, preparing vaccines in time for a pandemic, making sure that countries can locally manufacture vaccines, which will essentially mean that countries will be self-sufficient. Instead of wasting time to get a vaccine elsewhere, you could locally manufacture a vaccine.
Especially during a pandemic, you're right.
And that's where the response comes in.
Absolutely.
That's where response comes in for pandemic response. You need to be able to locally manufacture vaccines so that you're self-sufficient. And South Africa is placing itself front and center of this conversation. We know that there are some infrastructures that have already been put in place to address locally manufacturing.
And we're going to be talking about it a little later on with our guests, particularly on diagnostic, being a country that can also do that as well. But let's move on to the next slide now. What I'm concerned about, obviously, is that, you know, with all of this that is needed to be done and put in place, there is, of course, a concern around just the statistics around healthcare workers. Just talk to us through these numbers.
The dynamic we see playing out here essentially tells us that the countries with financial muscle are able to poach and retain health workers. And this gives us a picture of inequitable distribution of health workers. And health workers are the backbone of a health system. These are the people who deliver healthcare services. And how do you prepare for a pandemic? How do you respond to a pandemic if you have shortages of healthcare workers?
Absolutely. And
so that is essentially what is playing out here with these statistics. They are telling us that we aren't able to retain health workers, but economies that have stronger economies are able to poach or retain, and it makes retaining a health worker attractive in a particular area.
Having said that, then let's talk about, you know, the kind of, as you're saying, the kind of priorities that are needed, particularly when you look at human resources for health and retaining those skills.
So increasing investment in healthcare workers, their education and their skills is something that took center stage at the fourth G20 Health Working Group meeting. And the issues around prioritizing the issues that healthcare workers are facing, poor working conditions, poor remuneration issues, those are the things that were discussed. But what really touched my heart, which I thought was a human element to a high-level discussion, was the occupational health and safety of health workers. For the health workers that we do have in the system, how are we taking care of them? How are we taking care of the caregiver? And their mental health, their well-being, psychosocial support, having spaces that are safe for you in the workplace. We've seen in South Africa where, as SABC News, we've covered stories where nurses were attacked while, you know, on the line of duty. So their safety and their well-being is something that I thought was quite a good human interest angle at a high-level discussion.
Let's wrap up our conversation with something else that has been critical that has come out, and that is, of course, our infrastructure. I mean, are we ready? Our companies, especially countries and these economies that we speak of that will be struggling, how are they then going about just strengthening some of their systems, infrastructure, of course, being one of them?
Essentially, what South Africa has done, in the wake of COVID-19 and learning from the COVID-19 pandemic, it came up with a pandemic preparedness plan of its own. It's already in motion, and some of these measures we saw play out in the cholera outbreak. We also see how South Africa is responding to mpox, and these responses are informed by that pandemic plan. And the infrastructure that we're seeing and the conversations around infrastructure are basically saying, South Africa, be pandemic ready. Where can we place essential infrastructure like rural areas, for example? We need to look at how different areas are performing. If you want to have a vaccine in a particular area, for example, a rural area, how do you manufacture a vaccine that wouldn't need high-end, expensive infrastructure like temperature? How to keep the vaccine at a cold temperature? So what are scientists saying? They're saying, let's talk about infrastructure that can help us come up with vaccines where in rural and remote areas we can have vaccines that can have a long shelf life, and you don't need to keep a vaccine in a fridge if you can't afford one in the first place.
Absolutely.
So that's where the conversation around infrastructure must speak to the community and the area and its shortcomings.
Absolutely. Thank you so much, Zandi, for unpacking all of that for us. Of course, a number of, priorities that are centered right here, and particularly that last one when we talk about, the way forward, that road to the 2026 UN high-level meeting. On this very topic, we know, of course, that will be discussed at the Leaders Summit, also held later this year in November. But thank you so much, Zandi, for all of that. Great stuff. SABC specialist researcher Zandile Myeza there for us.